15 mandatory exams for people over 60. Have you ever stopped to think about how little care today can completely change your quality of life in the future? What tests can prevent health problems before symptoms even appear? And how can you ensure that your health is up to date to make the most of every moment with the ones you love? At age 60 or older, the body begins to give signals that cannot be ignored. But are you aware of the main tests that can prevent, diagnose, and treat common conditions at this stage of life? Get ready, because in this video we will explore the 15 essential exams that everyone over 60 needs to know. It's not just about taking care of your health, it's about living with more energy, avoiding unpleasant surprises, and building a healthier future. And stay until the end, because exam 13 is one of the most important and few people remember it. Let's get started. Exam 1. General Checkup. General checkup exams are the basis of any medical evaluation, especially in old age. They include measuring blood pressure, weight, height, and calculating body mass index, BMI. This basic data may seem simple, but it provides essential initial insight into your overall health status. For example, high blood pressure is one of the main risk factors for cardiovascular disease, while weight and height help identify problems such as obesity or malnutrition, conditions that can directly affect your quality of life. Furthermore, changes in these indicators may signal the need for more detailed examinations, such as those covered in the next topics. Want to know how this simple checkup can prevent bigger problems? Stay tuned, as each step of this process is essential for your health. Exam 2. Complete Hemogram. The complete blood count is one of the most common and essential tests to assess health, especially after the age of 60. This exam provides a detailed analysis of blood cells, such as red blood cells, white blood cells, and platelets, revealing important information about possible infections, anemia, and even more serious conditions, such as leukemia. For those in old age, a complete blood count is especially important because the body can present deficiencies that often go unnoticed in everyday life. Mild anemia, for example, can cause constant tiredness and lack of energy, directly affecting quality of life. Changes in white blood cells can indicate infections or problems with the immune system, which tends to become more vulnerable as the years go by. Another fundamental aspect of the blood count is the platelet count, which is responsible for blood clotting. A low number of platelets can increase the risk of bleeding, while high levels can be related to health problems, such as thrombosis. Keeping this exam up to date is an effective way to prevent or treat diseases at an early stage. Remember, the blood count is quick, simple, and can provide valuable information for your health. Exam 3. Lipid Profile. The lipid profile is an essential test to assess blood fat levels, including total cholesterol, LDL, the so-called bad cholesterol, HDL, good cholesterol, and triglycerides. For those over 60, keeping these levels under control is crucial to preventing cardiovascular diseases such as heart attack and stroke. LDL, known to be harmful, can accumulate in the artery walls, hindering blood circulation. HDL has the opposite role. It helps remove excess cholesterol, reducing the risk of blockages in the vessels. Triglycerides, in turn, are related to fat metabolism and, when in excess, increase the chances of heart disease and pancreatitis. For many people, altered cholesterol and triglyceride levels have no obvious symptoms, but the damage may be happening silently. Therefore, the lipid profile is an essential test to assess these risks and plan lifestyle changes or necessary medical interventions. In addition to diagnosis, this exam helps monitor treatments already started, such as diets, use of medications to control cholesterol, or complementary therapies. The good news is that, with adjustments to your diet and exercise, many results can be improved quickly. Exam 4. Fasting Glucose. The fasting blood glucose test is essential for assessing blood sugar levels and early detection of type 2 diabetes, one of the most common conditions among people over 60 years of age. This exam is simple, quick, and can reveal a lot about the functioning of the body's metabolism. Fasting blood glucose measures the amount of glucose in the blood after an 8 to 12-hour fasting period. Normal levels indicate that the body is managing insulin well, the hormone responsible for regulating glucose. High levels can point to pre-diabetes or diabetes even before noticeable symptoms appear. For the elderly, it is even more important to regularly monitor blood glucose levels, as diabetes can bring a series of complications, such as problems with the eyes, retinopathy, kidneys, nephropathy, and even nerves, neuropathy. Furthermore, glucose control is directly linked to heart health and the risk of other chronic diseases. If the results are altered, your doctor may recommend dietary changes, increased physical activity, or even starting medication treatment. The sooner these steps are taken, the greater the chances of avoiding future complications. Now that you understand the importance of fasting blood glucose, we move on to the next topic, renal function. Exam 5, renal function. Kidney function is assessed through tests that measure the levels of creatinine and urea in the blood, in addition to the glomerular filtration rate, GFR. These exams are crucial for people over 60, as the kidneys tend to lose efficiency over time, increasing the risk of kidney disease. Creatinine is a byproduct of muscle metabolism eliminated by the kidneys. When your levels are high, it could be a sign that your kidneys are not working properly. Urea, in turn, is a residue from protein digestion and, like creatinine, reflects the body's ability to filter and eliminate toxic substances. Glomerular filtration rate, a calculation based on creatinine levels, age, sex, and weight, is considered the most accurate method for assessing kidney health. This indicator is essential for identifying diseases such as chronic renal failure in the early stages, when it is still possible to prevent the condition from progressing. For the elderly, prevention is even more important, as kidney problems can develop silently and worsen other conditions, such as high blood pressure and diabetes. Drinking plenty of water, adopting a balanced diet, and monitoring these exams regularly are fundamental steps to preserving kidney function. Exam 6, liver function. Liver function is assessed using blood tests that measure enzymes such as TGO, AST, and TGP, ALT, as well as bilirubin and albumin. These indicators help check the health of the liver, an essential organ for several functions in the body, such as nutrient metabolism, protein production, and elimination of toxins. After the age of 60, the liver may face an accumulation of aggressions throughout life, such as the consumption of medication, alcohol, or even viral infections. Diseases such as hepatic steatosis, fatty liver, and hepatitis can be detected early with these tests, even before they present symptoms. The enzymes TGO and TGP, for example, indicate whether there is inflammation or damage to liver cells. Bilirubin, a pigment present in the blood, can signal problems such as jaundice or obstruction of the bile ducts. Albumin, a protein produced by the liver, is an important marker of the organ's functional capacity. The good news is that with early detection of liver changes, it is possible to reverse or control many problems. Adopting a balanced diet, limiting alcohol consumption, and undergoing routine exams are fundamental steps to keeping your liver healthy. Exam 7, bone densitometry. Bone densitometry is an essential test to assess bone health, especially in people over 60 years of age. It measures bone mineral density, identifying conditions such as osteopenia and osteoporosis, which increase the risk of fractures, particularly in the hip, spine, and wrists. With aging, loss of bone mass becomes a more common problem, especially among women after menopause, due to the drop in estrogen levels. However, men can also suffer from osteoporosis, especially those with a history of smoking, excessive alcohol consumption, or health conditions that affect bone metabolism. The exam is quick, painless, and uses a small amount of radiation to evaluate the bones, usually in the lumbar spine and hip. Results below expectations may indicate the need for interventions, such as dietary changes, calcium and vitamin D supplementation, or even the use of medications to strengthen bones. Furthermore, early diagnosis through bone densitometry can prevent serious complications, such as fractures that can limit mobility and affect quality of life. Keeping your bones strong is essential for an active and independent life in old age. Exam 8, Electrocardiogram and ergometric test. The electrocardiogram (ECG) and the exercise test are fundamental exams to assess heart health, especially in people over 60 years of age. While the ECG records the electrical activity of the heart at rest, the exercise test monitors cardiac performance during physical exertion. Together, these tests help detect conditions such as arrhythmias, ischemia, and other cardiovascular diseases. In an electrocardiogram, electrodes placed on the skin capture electrical signals that show how the heart is working. It is a quick, painless, and highly efficient exam to identify irregularities in the heartbeat and signs of obstructions in the coronary arteries. The exercise test, performed on a treadmill or exercise bike, evaluates the heart under effort. It is ideal for detecting problems that may not appear at rest, such as angina or coronary insufficiency. This exam is also useful for evaluating physical fitness and guiding safe exercise in old age. With the risk of heart disease increasing after age 60, having these tests regularly can prevent serious complications, such as heart attacks and heart failure. Furthermore, they offer an early diagnosis, allowing for more effective and personalized treatments. Exam 9. Eyesight exam. An eye exam is essential for people over 60 years of age, as vision tends to undergo natural changes with aging. It helps detect problems such as cataracts, glaucoma, age-related macular degeneration, AMD, and diabetic retinopathy, conditions that can seriously compromise quality of life. Cataracts, for example, are one of the main causes of vision loss in the elderly, characterized by the opacity of the lens, which makes it difficult to see clearly. Glaucoma, a silent disease that affects the optic nerve, can lead to irreversible loss of vision if not diagnosed and treated early. Macular degeneration, in turn, compromises central vision and can make everyday activities such as reading and recognizing faces difficult. Patients with diabetes should also be aware of diabetic retinopathy, which can cause damage to the retina due to high blood glucose levels. The exam is simple and includes visual acuity tests, eye pressure measurements, and detailed retinal assessments. By having regular appointments with an ophthalmologist, it is possible to treat problems before they worsen, ensuring clearer, healthier vision for longer. Exam 10. Audiometry. Audiometry is an essential test for people over 60 years of age, as it assesses hearing capacity and helps identify early or advanced hearing loss. As we age, it is common for hearing to change due to presbycusis, a natural condition caused by wear and tear on the structures of the inner ear. The impact of hearing loss goes far beyond simply not hearing well. It can affect communication, reduce quality of life, and even contribute to social isolation, increasing the risk of depression. Studies also associate untreated hearing loss with a greater risk of cognitive decline, such as dementia, which reinforces the importance of early diagnosis. Audiometry is a simple and non-invasive test, carried out in an acoustic booth. The patient listens to different sounds and frequencies to determine which ones can be perceived. The test identifies whether there is mild, moderate, severe, or profound hearing loss, guiding the healthcare professional in choosing treatments, such as the use of hearing aids. Even mild hearing losses deserve attention, as they can progress over time. Regular consultations with an otorhinolaryngologist and audiometry help preserve hearing health and maintain an active and participatory life. Ready for the next exam? We now continue with colonoscopy. Exam 11. Colonoscopy. Colonoscopy is a crucial exam for people over 60, especially for the early detection of colorectal cancer, one of the main causes of death among the elderly. This exam allows a detailed visualization of the interior of the colon and rectum, helping to identify polyps, inflammations, ulcers, and other abnormalities that can evolve into more serious conditions. Colorectal cancer usually develops from polyps, small formations that can be removed during the examination itself. Early detection considerably increases the chances of successful treatment and cure, making colonoscopy an essential tool for prevention. The procedure is performed with the aid of an endoscope, a flexible tube with a camera at the end, which allows the doctor to examine the entire length of the colon. Although many people fear the preparation and discomfort, The benefits of this exam outweigh any inconvenience, especially in preventing future complications. Colonoscopy is also indicated to investigate symptoms such as changes in bowel habits, persistent abdominal pain, or blood in the stool. Even without symptoms, it is recommended to be tested regularly from the age of 50 or earlier if there is a family history of colorectal cancer. Exam 12. Mammography for women. Mammography is an essential exam for women over 60 years of age, being the main tool for the early detection of breast cancer. This condition is one of the most common among women in this age group, but when identified in the early stages, the chances of a cure are extremely high. The exam uses X-rays to capture detailed images of the breasts, allowing the doctor to identify changes such as nodules, microcalcifications, or other anomalies that are not detectable by touch. It is recommended even for women who do not have symptoms, as many changes can be silent in the early stages. After the age of 60, mammography should be performed annually or as recommended by a doctor, considering individual risk factors, such as a family history of breast cancer or genetic changes. Early detection also allows for less aggressive treatments, preserving patients' quality of life. In addition to mammography, it is important that women continue to perform regular self-examination and routine consultations with a breast specialist. Preventive care is essential to maintain health and avoid future complications. Exam 13. Prostate exam for men. Prostate examination is essential for men over 60 years of age, as it is one of the main ways to detect prostate cancer early, which is the second most common type of cancer among men. Additionally, this test helps diagnose other conditions, such as benign prostatic hyperplasia, BPH, and prostatitis. The evaluation usually includes two main procedures: a blood test to measure PSA, prostate-specific antigen levels, and a digital rectal examination. PSA is a protein produced by the prostate, and when at high levels, it may indicate changes that require investigation. Rectal examination allows the doctor to assess the size, texture, and possible nodules in the prostate. Although many men still feel afraid or uncomfortable about undergoing a digital examination, it is important to remember that it is quick, painless, and can save lives. Early detection of prostate cancer considerably increases the chances of a cure and allows for less invasive treatments. For men with a family history of prostate cancer or risk factors, such as obesity and a sedentary lifestyle, screening should begin before age 50. Maintaining regular follow-up with a urologist is essential to ensure prostate health and prevent future complications. Exam 14. Vaccines and serologies. Updating the vaccination schedule is a priority for people over 60, as the immune system tends to weaken over time, leaving the body more susceptible to serious infections. In addition to vaccines, serological tests help identify the presence of antibodies against certain diseases or active infections that need attention. Among the most important vaccines for seniors are the flu vaccine, which must be taken annually to protect against complications from the influenza virus, and the pneumonia vaccine, which prevents infections caused by bacteria such as pneumococcus. The herpes zoster vaccine is another essential recommendation, as it reduces the risk of developing the painful condition known as shingles. Serologies, in turn, are blood tests that detect past or current infections, such as hepatitis, HIV, and toxoplasmosis, in addition to verifying the need for vaccine boosters. These tests also help monitor immunity to diseases such as measles and mumps, ensuring continued protection. Keeping your vaccinations up to date and carrying out serological tests periodically is essential to preserve your health and avoid complications that can compromise your quality of life. Regular medical monitoring ensures that these measures are carried out at the right time. Exam 15. Lung function. Assessment of lung function is essential for people over 60 years of age, as aging can compromise respiratory capacity and increase the risk of diseases such as asthma, chronic bronchitis, emphysema, and chronic obstructive pulmonary disease, COPD. Tests such as spirometry and pulse oximetry are essential to identify problems early and prevent complications. Spirometry is a simple, non-invasive test that measures the amount of air that the lungs can inhale and exhale, as well as the speed of this process. It is especially useful for diagnosing and monitoring conditions such as COPD, which affects millions of people worldwide and is often underdiagnosed. Pulse oximetry measures oxygen levels in the blood, helping to detect breathing difficulties. This exam is quick, painless, and can be performed in the doctor's office or at home if necessary. Maintaining lung health is vital to ensuring a good quality of life in old age. Avoiding smoking, practicing moderate physical exercise, and carrying out routine exams are fundamental measures to preserve respiratory function. By detecting problems early, it is possible to control symptoms and significantly improve your ability to breathe well. 16. Neurological Examination. The neurological examination is essential for people over 60 years of age, as the nervous system is also subject to natural wear and tear with aging. This exam helps identify signs of conditions such as dementia, Alzheimer's, Parkinson's, strokes, and neuropathies, problems that can directly affect mobility, cognition, and quality of life. The process includes a detailed assessment of reflexes, muscle strength, coordination, balance, memory, language, and fine motor skills. Tests such as magnetic resonance imaging or tomography can complement the clinical examination, allowing changes in the brain and spinal cord to be identified. Early detection of neurological diseases is crucial to initiating treatments that can slow the progression of conditions, alleviate symptoms, and improve quality of life. For example, in the case of Alzheimer's, early diagnosis allows interventions that help preserve cognitive functions for longer, in addition to offering emotional support and guidance for the family. Additionally, seemingly simple problems such as tremors or frequent falls may be the first signs of underlying neurological conditions. Carrying out the exam regularly, especially if there is a family history of neurodegenerative diseases, is an essential preventive measure. Taking care of your health after the age of 60 is an act of self-love and also a way of ensuring quality moments with those you love. The 15 exams we list throughout this video are not just medical protocols. They represent important steps toward preventing disease, detecting problems early, and living a fuller, healthier life. Remember that by carrying out these exams regularly, you are investing in your well-being and creating the foundations to enjoy each phase of life with willingness and joy. Don't wait for problems to appear before taking action. Prevention is always the best way. And now you know exactly what you need to do to take care of your body and mind. So, book that doctor's appointment you've been putting off, organize exams, and share this information with friends and family who also need to take care of themselves. The more people know about the importance of this care, the greater the positive impact on everyone's health. If you like this content, subscribe to the channel, leave a like, and turn on notifications to receive more important tips like these, and don't forget to watch the next video. Together, let's build a long and healthy life.